Adventist HealthCare is committed to providing quality care and the best services for the diverse people and communities it serves. To provide culturally responsive care, our physicians, nurses, and other staff must first understand cultural differences and respect patients' values and needs. Understanding and valuing different cultural beliefs and practices is an important part of caring with compassion and empathy. Meet Hassan and Sama, a Muslim couple. Sama is in labor. Hassan requests a female physician to deliver their baby because of their religious beliefs. However, in this scenario, only a male physician is on call. What would you do? By the end of this course, you should be able to define culturally responsive care, describe the requirements for providing patient-centered and equitable care, and finally, identify strategies for providing culturally responsive care. Culturally responsive care is the ability to provide care to patients with diverse values, beliefs, preferences, or behaviors. That includes understanding the different populations you serve and tailoring healthcare delivery to meet patients' social, cultural, and linguistic needs. The U.S. Census Bureau projects that by the year 2044, racial and ethnic minority groups will represent more than half of the nation's population. Adventist HealthCare serves several majority-minority counties, meaning that less than half of the residents in each county identify as non-Hispanic white, and our team members reflect this diversity. Adventist HealthCare has a diverse workforce and community. We serve each individual no matter their physical or mental condition, age, race, ethnicity, gender, sexual orientation, nationality, faith, or status. This includes people who face socioeconomic challenges or cultural barriers when seeking care. How does Adventist HealthCare provide culturally responsive care? During each hospital visit, from registration through discharge, we collect relevant patient data. That includes race, ethnicity, language preference, sex, and gender identity. We use this data to anticipate needs, meet expectations, guide clinical decisions, and serve our communities in culturally responsive and respectful ways. How can you, personally, provide culturally responsive care? We're all shaped by such things as our personal characteristics, experiences, culture, and education. These factors shape how you see yourself, as well as how you see and understand or even treat others. Expand your cultural knowledge, cultivate deeper connections, listen without judgment, and build trust with diverse patients. Use familiar words to communicate clearly with patients and families. And when caring for patients with limited English proficiency, always use an interpreter. To establish patients' understanding and prepare them for what's next, use the teach back method to have them repeat what they heard explained to them. Finally, the LEARN model is an effective cross-cultural communication tool to demonstrate culturally responsive care and bridging the gap behaviors. For example, in the case of our Muslim patient, first, listen with empathy to understand the patient's values and cultural needs. In our case, Hassan is asking for a female physician. Then explain the situation. For example, I'm the only doctor available. Acknowledge challenges or barriers and discuss potential solutions. Our doctor should explain that he acknowledges that this is an issue for the patient. Then recommend an action, which could be having female nurses present with the male doctor. And lastly, negotiate a mutual agreement of that plan. Remember, your colleagues, the community in which you live and work, and the people you serve are very diverse. Understanding and respecting patients' values and beliefs and responding to their social, cultural, and linguistic needs is key to how we provide care at Adventist HealthCare. We will provide a world-class patient experience to every person, every time.